Okay, so we'll quickly try to look at the next type of fracture which we'll be looking at, and this is what is known as periprosthetic fracture. Okay, periprosthetic fracture. So for the periprosthetic fracture, it just simply has to do with fracture that is around what? A prosthetic joint, you understand? Prosthetic joint is basically what you have done to replace a joint that has been diseased and all of that, you know. So it's just a bone fracture and it occurs around an orthopedic implant, you know. That's a prosthesis, okay? So most of the time these prostheses are put around the hip, it could be the knee, it could be the shoulder. So where it occurs mostly at hip replacement joint is a hip replacement. Okay, this one too is hip, but just know that you can also have knee replacement fracturing. You can also have replacement at the elbow fracturing. You can also have replacement at the shoulder joint fracturing. So causes is mainly trauma, bone weakness, maybe some surgical factors like some malposition implants, and also sometimes loosening of the implants. So you classify it using what? The Vancouver classification, that's mainly for the hip. So type A is fracture near the trochanter, type B is what? Fracture around or just below the stem. Okay, then we have the B1, B2, B3, depending on the range. Then we also have the Su classification. This is based on the location relative to the femoral component, that's for the knee. So management just depends on how stable the implant is after fracture. Do you understand? And you understand. So also stable implants, loose implants, you get, that's what I actually tell you the range. So non-surgical management include minimally displaced ones, maybe they could just revisit the surgery. So this ones to the management depends on if it is stable or if it is still loose. So that's what we have for what a periprosthetic fracture is.